Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Blowing ad budget on metrics that look great till the CFO sees them? That's bull spend. And marketers are calling it out in Dashboard Confessions.
I remember telling my boss, it'll be good for the brand, when leads were slow. Yeah, it wasn't.
Cut the bull spend. LinkedIn lets you target by company, job title, and more. Advertise on LinkedIn. Spend $250 on your first campaign and get a $250 credit. Go to linkedin.com/campaign. Terms and conditions apply.
Absolutely. So you want to confirm whatever you need access to that your plan covers. And there's great resources out there that can help you find the doctors that you need to see, as well as prescription drugs too. So those are the two things that you want to make sure and weigh. Is my doctor in network? Are my doctors in network? And how are my prescription drugs going to be covered, so you don't have a surprise at the pharmacy?
Hey everybody, this is Jonathan Marks from Go2 Health. I hope you're having a wonderful day. We've got another important show. Hey everyone, this is Jonathan from Go2 Health. Here we are in March, and we don't want to think about it, but tax time is coming up. And I always like to say we need to take care of our financial health as well as our physical and mental health. And that's where Monarch software comes in, the all-in-one personal finance tool designed to make our lives easier. Simplify your finances with Monarch. Monarch is the all-in-one personal finance tool designed to make your life easier. It brings your entire financial life, budgeting, accounts and investments, net worth and future planning together in one dashboard on your phone or your laptop. Feel aware and in control of your finances this tax season and get 50% off your Monarch subscription with code GO2. Your mental health is improved when you can see your entire financial life, budgeting, accounts and investments, net worth and future planning together in one dashboard on your phone or laptop. I'm reviewing all my revenues and expenses from last year in a beautiful clean dashboard, and I'm about to share it with my accountant to prepare my tax return. That's a great load off my mind. Monarch keeps me focused on planning and hitting financial milestones, not just tracking my spending. Monarch gives me a complete picture, budgets, debt payoff timelines, savings goals, net worth, so I can make decisions that actually move the needle. And surprise, Monarch has all these AI tools built in, offering me 24/7 access to a financial coach, insights into my spending, and weekly recaps so I can stay on track. Monarch keeps me focused on planning ahead and hitting real financial milestones. As a Go2 Health listener, you can ease your mental stress with Monarch. Achieve your financial goals for good with Monarch, the all-in-one tool that makes money management simple. Use code GO2 at monarch.com for half off your first year. That's 50% off at monarch.com, code GO2. Help take the stress out of your life with Monarch. The Medicare annual enrollment period is open now through December 7th. It closes December 7th, so make your choices. This gives beneficiaries a limited time to review their coverage and make changes for 2026. Premiums, deductibles, and prescriptions can change, so taking time now helps avoid costly surprises later. People who are enrolled in original Medicare can choose plans with additional benefits, such as Medicare Advantage plans with extras like dental, vision, hearing, fitness, transportation, and even post-hospital discharge meals. Additional plan options include Medicare supplement plans and standalone Part D prescription drug plans. With us to talk about this today is Jessie Quick, Head of Marketing for HealthSpring, formerly Cigna Healthcare Medicare. She focuses on group, individual, and family markets, Medicare, and Medicaid lines of business. She's been with the company for 16 years and knows what she's talking about. If you want to learn more, you can go to healthspring.com. Before we get to Jessie, a quick request. If you like what you're hearing on our show, please give us a 5-star review on Apple, Spotify, or YouTube, or wherever you're listening to us. It helps us get the word out to more people. Thanks in advance. So welcome to the show, Jessie Quick. How are you today?
Hi, Jonathan. I'm doing well. Thanks so much for having me.
Wonderful. So tell us, what is the Medicare annual enrollment period and when does it end? I know it's coming up soon.
You are correct. It is rapidly approaching. So the Medicare annual enrollment period is Medicare beneficiaries' annual opportunity to review and make changes to your coverage. The deadline is December 7th, and the changes take effect January 1st of 2026.
And why is there, if you understand, I don't know these rules, but why is there just an enrollment period? Why can't people enroll any time of the year? Do you know about that?
That is just a longstanding rule that has been in place. And the key here is know the name of the game and know the rules. So now is the time when you can make your changes. Plans change yearly. That can include premiums and deductibles, networks and drug lists. And let's be real, your health status, changes in your health come about too. And so it's important to understand what your options are in this enrollment period so that you don't get caught with surprises later, because you're not going to be allowed to make a plan change when you need it.
Good. Thanks for explaining that. So tell us, what are the different kinds of plans for Medicare beneficiaries?
Well, there's a lot of plans out there, but they all fall into one of three buckets. So the first type is a Medicare supplement plan, or commonly referred to as a Med Sup plan. And these supplement plans help pay for costs that original Medicare, which is Part A and B, does not cover. So that's one type of plan that you will find out there in the market. Another type is called Medicare Advantage. And Medicare Advantage, I think of it kind of as a one-stop shop. It combines hospital, medical coverage, like your doctor's office visits, and often prescription drug coverage is included in the Medicare Advantage plan. Mm-hmm. And then also some extras as well. So that can be like dental, vision, hearing. So that's I would say more of a bundled coverage that you can find in the market. And then finally, Jonathan, Part D, these are standalone prescription drug plans. And if you enroll in a Medicare supplement plan, you will not have access to prescription drug coverage. So you're going to want to buy a Part D plan. Mm-hmm. But if you enroll in a Medicare Advantage, most of the time drug coverage is included.
Got it. Thanks for explaining that. How do you find the right Medicare plan for your health and your lifestyle and your budget? How do I make this choice?
There's a simple checklist that I recommend following. First and foremost, make sure you read your annual notice of change. This is also called an ANOC. You should have received it in the mail in September if you are currently enrolled in a Medicare plan. You also want to make sure that your doctors, your preferred pharmacy, and the hospital that you prefer to use are in network. So make sure that you've got in-network coverage to the access that you need. You want to consider also your own health, chronic conditions. If you have diabetes or a heart condition or even COPD, for example, you want to check and see if you have the right specialists in the network, including coverage to therapies and care coordination. And then finally, I recommend making sure that you're looking at the total annual cost. A lot of folks will get zeroed in on the premium, where they're just thinking about what amount do I owe on a monthly basis to the health insurer. But you want to compare your total annual cost, which includes your deductible, your co-pays, your co-insurance, and your out-of-pocket maximum. So when you put all of that together, that will give you a better sense of your total financial liability. So you want to weigh this before you make your plan selection.
You said a key point that I want to underline, which is to make sure that the doctors you want to see are in the Medicare Advantage plan that you want to have cover you. So you want to make sure that your doctors are in that network. That's so important if you want to keep seeing the doctors you've been seeing already, correct?
Absolutely. So you want to confirm whatever you need access to that your plan covers. And there's great resources out there that can help you find the doctors that you need to see, as well as prescription drugs too. So those are the two things that you want to make sure and weigh Is my doctor in network? Are my doctors in network? And how are my prescription drugs going to be covered? So you don't have a surprise at the pharmacy.
Great. So, Jesse, you work for HealthSpring, which is formerly Cigna Healthcare Medicare. Tell us, what is HealthSpring and why might people want to consider going with you for coverage?
Now, I'm so glad that you asked. So HealthSpring is Healthcare Service Corporation's newest brand. Healthcare Service Corporation acquired Cigna Healthcare's Medicare business, and we've rebranded it to HealthSpring. So the name might be new, but it's the same trusted coverage and service that the market knew with Cigna Medicare. A little bit about Healthcare Service Corporation. We are the nation's largest customer-owned health insurer with 26.5 million members in all 50 states. And of that, we've got over 4 million Medicare members alone.
Wow. And is there any difference in the kind of coverage you can get with HealthSpring than you can with other companies?
There are a lot of great options that we offer. They do vary by market and by plan. So we recommend visiting us at healthspring.com, or you can call us at 877-349-2897. That number again is 877-349-2897. And we have got experts that can help you evaluate your plan options and find one that works best for your health needs as well as your budget.
Good. Now, for my old brain here, tell me again, Jesse, when does the Medicare annual enrollment period end?
You have until December 7th to decide for your coverage, and that goes into effect January 1st. So the key here is not to wait to take action, because we are in the annual period right now. December 7th is the hard deadline.
Great. Jesse, is there any question that I should have asked that I didn't, or what kind of big message would you like to leave with people today?
You know, Jonathan, I think we've hit it. The key is make sure that you evaluate all of your options. You don't have to be afraid to ask for help. There's great resources out there. You can go to medicare.gov, or you can call 1-800-MEDICARE to learn more about your options. And again, we at HealthSpring would love to be a resource and help you evaluate your options. So be sure to check us out at healthspring.com, or give us a call at 877-349-2897.
Good. Jesse, thanks so much for being with us today with this important reminder.
Thank you, Jonathan. It was a pleasure.
Yes, thank you. Jesse Quick is the head of marketing and leads go-to-market efforts for HealthSpring, which is formerly Cigna Healthcare Medicare. She's focused on group, individual, and family markets, Medicaid, Medicare lines of business. She's been with the company more than 16 years, and she aspires to create meaningful connections by delivering insightful, data-driven strategies that elevate your customer experience, drive engagement for you, and everybody can benefit. Before we go, just a quick reminder, if you like what you're hearing, please give us a 5-star review or a thumbs up on Apple, Spotify, or YouTube, or wherever you're listening to us. It helps us spread the word. This has been Jonathan Marks with Go to Health, and as we say at the end of every show, go to health. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.